I had to write it down. I would like to know, why do I wake up at 3 o'clock a.m. with my blood pressure high? Until I go and take magnesium tablet, it kind of slows me down and I go back to sleep. So why does it happen?
Oh, okay. That's a great question. Why do many of us wake up early in the morning and kind of like we feel stressed and blood pressure might be up, as in your case, or we're like wide awake and like, why, now I can't get back to sleep. I see this a lot in my practice. Number one, I'm really pleased that you understand and take advantage of using magnesium as an appropriate nutrient supplement. 75% of Americans are actually, frankly, deficient in magnesium. Okay, and that means that most of us should be taking advantage of taking magnesium as a supplement. And that is in addition, above and beyond, optimizing mineral intake through a whole plant-based diet. One of the problems is that many people do not absorb nutrients very well. No matter what they eat, they don't absorb especially minerals very well. And there's a lot of reasons for that. Digestion is a challenge that many people have, and the lack of fully producing the optimal amounts of hydrochloric acid during a meal, which if you watch TV, you think that that's the worst thing you could do is produce acid, when in fact, God designed the stomach to produce lots of acid. The stomach, if it's not acidic at mealtime, will not digest food properly. And so a lot of us have inadequate hydrochloric acid, which means we don't absorb minerals very well. And that's one of the reasons that we tend to have problems with fluctuating blood pressure, restless leg syndrome, muscle cramps. And I mean, the magnesium is so important that it's one of the first things I recommend for depression, for anxiety, for many, if I know a patient has a tendency towards heart disease, if they have a tendency towards high cholesterol, it's actually more important to have optimal magnesium, in my opinion, in your blood than to have a lower cholesterol. Because studies out of Harvard 30 years ago were showing that with teenagers, if their cholesterol was high, you could see the fatty streaks, like a piece of string cheese melted into the artery wall. You could see that already in teenagers. Okay, but the same study showed if those teenagers had optimal levels of magnesium in their bloodstream, you did not see those fatty streaks anymore. So while cholesterol is important, it is a marker for heart health, there's no question. It's actually not at the top of the list, in my opinion. It's actually much lower on the list. Proper nutrition is far more important than what your cholesterol is. I would rather be on a plant-based diet and have a high cholesterol than have a low cholesterol and eat whatever. Okay, because the plant-based diet is what brings health and healing. Now, specifically your question about waking up at 3 o'clock in the morning. I find that a large percentage of my patients who struggle with this actually have a tendency to hypoglycemia. And I alluded to this a little bit last night and this morning. And that's why one of the tests that I strongly recommend, like if I was seeing you clinically and you brought that question to me, the first test I would actually do on you, and of course I'd want to look at a lot of different things, but the most important thing would be doing what's called a 4-hour glucose tolerance test. It's not done very often clinically, but I've done it since 1990 when a geriatrician at Loma Linda University, and I practiced with her at the faculty medical group, gave me a family practice audio cassette back then of the best lecture of the month for all family doctors. And it was Dr. Nancy Bohannon at UCSF, an endocrinologist, said most people have insulin resistance. If your insulin levels are high, we need to get those down because it's your #1 risk factor for heart disease. And as I was suggesting last night, it's also one of the #1 risk factors. It is the #1 risk factor for many people driving Alzheimer's, etc. but it's also a number one trigger of early morning wake up. An unexpected, or maybe you're expecting it if you're used to it, but it's not, obviously you don't want it, right? You don't want to wake up at 3 in the morning or at 2 in the morning. So the reason I do a 4-hour glucose tolerance test is because you go in the morning at the lab at 8 o'clock when they first open. They draw your blood sugar and whatever else they do, and then they give you a sugar drink to see how does your body handle sugar. How high does your blood sugar go? So it's the best test to diagnose prediabetes or diabetes. By far, the most sensitive test. 75% of people who are told they don't have diabetes because they don't have a high A1C, they actually, let me rephrase that. Screening for diabetes with an A1C will miss 75% of people who actually have diabetes, because only checking your blood sugars after a sugar drink or a meal catches the majority of people with the problem, right? So if your blood sugars go up, then your insulin will go up, and then that extra insulin will drive your sugar too low. So this can happen even without your blood sugars going up. If your blood sugars eventually drop at 3 or 4 hours after a meal, that is actually a clue of one reason that some people can't sleep straight through the night, that they get woken up almost like a start, like, what's wrong, right? Breathing rapidly, and the heart rates bump, and that's a major clue that your adrenal glands kicked in. Your stress hormones have kicked in, and that's what makes the blood pressure go up. Okay, so your stress hormones have kicked in. The question is why? Why would your stress hormones kick in the middle of the night when you're sleeping? And the common reason, and I'm not saying this is in your case, but that's why I do the test, to see if it is this. If your blood sugar it tends to drop sometime after a given meal, that low blood sugar means that your adrenals have timed out. Your adrenals are not strong enough to release the cortisol necessary to keep the blood sugar stable. So the blood sugar should never drop anytime, even if you haven't eaten for days. The blood sugar should never drop too low. So when it does, that tells us that the adrenals, the very gland of the body that is designed to monitor blood sugars, and if they start seeing the sugars drop a little bit, it will release cortisol. That'll tell the liver to release a little sugar, and that stabilizes blood sugar. So when blood sugars drop, it tells me two things. Number one, the adrenals are not strong enough to prevent that. So that's what we call adrenal fatigue or adrenal insufficiency, okay, at an early phase. Okay? And the other thing that's happening is that the extra insulin that's being produced is driving the sugar too low in the first place. So if I actually find that on the test, then we work at introducing actually strategies that will be discussed in detail in the Diabetes Undone program starting next week, or next Sunday. Or next Sunday is the testing, and then Monday, I believe. Is that right, Dr. Westerdahl? Okay, so Dr. Westerdahl in the back, turn around, wave, Dr. Westerdahl. He's my colleague. We've worked together for many decades now. And I never thought I'd ever have to say that I've worked with people for decades. But we have. It's true. So I've really enjoyed participating in his radio show. He does a regular radio show, and he's going to be the facilitator of the Diabetes Undone program starting not this Monday, but the following Monday. So take advantage of that. It's the very best program for these type of things. So I would actually try to do that 4-hour glucose tolerance test. Get your insulin levels done at fasting 1 and 2 hours into the program. And then what I do, I actually order a fasting 3 and 4 hour cortisol. It's not absolutely necessary to do the cortisol, but it tells me it's that third factor that proves to me that there's a problem with the adrenals. Okay, and I would say that maybe 70% of the time, once we find that and we initiate a comprehensive program to balance that, they're able to sleep through the night. Okay, so the key that when we're dealing with any type of insomnia, some people, they can't fall asleep. They just lay there for hours and hours, and that's a different type of insomnia. But when we have, do I need to back up here, or when we have this, when you're able to fall asleep fairly well, and then you wake up in the middle of the night, wide awake seemingly, then that's the first thing I do is consider hypoglycemia and adrenal insufficiency. You know why I know about this? I'm an adrenal fatigue patient, right? I've had weak adrenals all my life. My mother was so concerned about me, my stepmother, when I was 17. I was a high energy athlete, teenager, but I would crash. And that's a sign of that I was just born with adrenals that weren't optimized. And so that's one of my congenital tendencies, that my adrenals, I need to really protect my adrenals, which means don't let your sugars get up. Don't let yourself get stressed out. Make sure you get enough sleep. Make sure that you're exercising lightly after every meal, not hard. And so you just cover. Make sure you're eating the right foods. All those things factor in, and then we nourish the adrenals various other ways. So check that out. That's what I would do. But keep taking your magnesium.
Does it have something to do with a fatty liver?
Okay, follow-up question is, could it have something to do with fatty liver? Well, every organ system that is somewhat compromised will tend to compromise other systems as well. So the short answer is yes, it could have something to do with that. Because a fatty liver means the liver is under stress. It's not detoxifying optimally. It's not maybe using glutathione at an optimal level to get rid of other toxins. Of course, that's going to have an impact on the adrenals. That's an environment that the adrenals have a more difficult time with. So all the more reason to get involved in an aggressive program like Diabetes Undone that is very broad in its impact, and provide some initial testing next Sunday that will give us some clues to that as well. Yes?
I have rheumatoid arthritis and thyroid problems. I also just was diagnosed with a PFO. I take methotrexate injections, and I notice after I do so that it literally makes me swell up and have like hot flashes, so much so that it's horrible. My whole body's on fire, yet I'm chilled. Now, I know diet's a good thing, and it's but is that something I should be worried about? And second question is kind of, have you ever heard of lymphedema, and is that a thing?
Okay, all right. So in general, rheumatoid arthritis is a very significant and serious autoimmune disorder. I briefly mentioned this morning in my talk, showing how stress issues can really drive, or at least initiate autoimmune tendencies, and sometimes we develop early autoimmune symptoms like dry eye syndrome, Hashimoto's thyroiditis. An autoimmune inflammatory attack of thyroid is one of the most common autoimmune diseases. Oftentimes it's discounted in medicine as, well, we just treat your thyroid. But the issue is if you have Hashimoto's, or an autoimmune inflammatory process in the thyroid, then that inflammatory autoimmune process should be addressed. Yes, you should treat thyroid according to guidelines, okay? But you should also treat the underlying cause of the problem, right? And so many times people have early more subtle autoimmune problems. And because we're not trying to figure out the cause, it leads to more serious other forms of autoimmunity. It's been said that women in particular, but also men who have a mild autoimmune disease are much more likely to develop a worse autoimmune disease within the next 5 years. So this is especially for women because of the hormonal factors that can influence this as well. So we just need to be aggressive. So short answer to your question is, I believe that nutrition, what we eat, is the foundational pillar of beginning to mitigate the underlying drivers of autoimmunity. And so, for instance, the Diabetes Undone program, it seeks to look at all the pillars with an emphasis on nutrition, since it's so powerful, to address that problem. So that would tend to improve both of those various conditions that you mentioned, and that would be the starting point, right? So we start with a foundation, and then we address the individual risk factors independently. You want to pipe in?
Yeah, it looks like Dr. Westerdahl has something.
Just to elaborate on what you said, I did a study with Dr. John McDougall. Some of you heard of Dr. McDougall. We did a rheumatoid arthritis study with a group of patients, put them on the same type of diet we're promoting in Diabetes Undone for 30 days. And 82% of the people in 30 days who had mild to severe rheumatoid arthritis had significant improvements in their symptoms.
And I've seen that as well.
And we've published that in a journal, too.
And by the way, thank you, Dr. Westerdahl, for mentioning that. 35 years ago, when I was starting to get into lifestyle medicine and nutritional medicine, I was saying, what am I going to use clinically? What protocols am I going to use? There was really nothing available for clinicians to, and you know what, my very first mentor was Dr. McDougall, and he wrote a book called McDougall's Medicine, where he talks about one of the key chapters in this very book, Dr. Westerdahl, was how to deal with rheumatoid arthritis, and I never forgot that. That was my foundational introduction to using a 100% plant-based diet as the basis for treatment and potential reversal of rheumatoid arthritis.
Okay, Doc, just I want to interject something in here.
Yeah.
You already introduced Dr. John Westerdahl, who will be the facilitator for our Diabetes Undone.
Yes.
And did you introduce Dr. Barton? Let's
No.
introduce Dr. Lorraine Barton. You want to stand up here?
Yes.
Dr. Lorraine Barton will be the one, the physician who will be doing all the lab analysis. Anybody who takes Diabetes Undone will receive a lab analysis. And by the way, we'll have opportunity later at this evening meeting. If you want a little brochure, didn't get this, on how to sign up for Diabetes Undone, we have some, just let me know and I'll get them into your hands. But, you know, again, later this evening after our evening meeting, we will give you an opportunity. Those who want to sign up can sign up right here for Diabetes Undone. But I was showing Dr. West the labs that were going to be done. He told me that many times those labs cost, you said, I think $150?
Yeah, up to that, yeah.
Yeah, $150. We're charging $199 for this entire deal. That includes all of your materials, everything. So this is really food we're giving you. And so this is really, really a good, excellent way. And again, I want to get back to the idea.
That's a good price just for the food you're going to be getting.
That's right. And I want to say that I think that there's something that needs to be corrected here, and that is that you don't have to have diabetes or even prediabetes to benefit from the
Absolutely.
principles. And I think that there are some people that they hear that Diabetes Undone, oh, that's not me. I was in that boat. And in fact, we're going to take just a couple of minutes to view. Some of you have seen the video that was recently produced on my story. It was produced back in June, and it is going to be part of it's a short little video. I think it's about 6 minutes in length, and it's going to be put on the Hope Channel television network to encourage people with their health issues. And I want to share this not as a means to say, hey, look at me. I want you to know there's no pride in myself personally. I give all the glory to God for the changes that have happened in my life. Because, folks, I was really sick. Yeah, amen. Those of you who knew me before, I mean, I was not healthy. I had constant aches and pains, Doc.
Right.
I mean, my joints and everything. Oh, man.
That's one of the things that can give you hope with any type of, inflammatory syndrome and pain, autoimmune arthritis, rheumatoid. So there's a great potential in being on the right diet. It may take some time, but it's the most important initial foundational thing you can do.
So we're going to show that brief video, and then immediately following that video, I'm going to put my labs up from before and after, and I'm going to let Dr. Youngberg talk about those.
I'm so glad Pastor Phil's willing to do that, because those examples will show you the potential of baseline and a good program like Diabetes Undone, all the things that you're learning, look at what you can expect from it.
Yeah. Okay, so let's roll the video. Let's see it right now. So I've struggled with obesity most of my adult life. After I went to college and graduate school, life just kind of started getting away from me, and the more time went on, the more pounds I put on. I was in a serious situation. I was in class 3 obesity, classified as being morbidly obese, and at that point in time I weighed 280 pounds. I did not feel good. I didn't have energy. I was on high blood pressure medication. My cholesterol was out of control. I was in the advanced stages of prediabetes. As I started to look at my children, my grandchildren, I started realizing, do I really want this? Is this where I want to be? Do I want to be a burden to them? The desire in my heart was that I would be there for them. And I knew that at my present pace, that was not going to happen. And so my wife and I discussed it, talked about the options, and realized that we were going to have to take a journey together. It was not something we could do solo. We had to do together. I tell people that I have discovered 3 steps to fitness. And step number 1 is a trip to your mind. You've got to make a choice. That's the first thing you've got to do. And for me, the choice was I didn't want to continue to live the way I was. And so I had to make that decision. And so once I came to that place and I realized that I needed to make those changes, then step number 2 was a trip to the kitchen. And we realized we needed to change what we ate. Now, the interesting thing of it is that for a number of years, my wife and I had practiced largely a vegan diet. Vegan being free of dairy and eggs, no meat, fish or poultry or anything like that. But I've come to discover that that really doesn't adequately describe the journey I'm on, because there are many things that are actually classified as vegan. Soda, potato chips, French fries. Vegan, but not healthy. Jan and I decided that we were going to start practicing a whole food, plant-based diet. The less processed foods we'd eat, the minimal amount of oil, and virtually cutting out oil in food preparation at all, high amounts of sugar. We started making those changes and things started happening. When I started thinking about, the direction that I wanted to go with my life, I decided that I was going to start working out. A friend of ours, a fellow member of our church, made a commitment to working out with us 3 days a week. And so we would work out 1 hour a day, 3 days a week. And it was interesting because in that period of time, working out, and I mean, it was a hard workout. In 4 years, I lost 15 pounds. But once we set our minds on making some healthy lifestyle changes, in 4 weeks, I lost my next 15 pounds. I've lost more than 90 pounds. My wife has lost more than 40 pounds. Step number 3 then was a trip to the gym, and we continued to work out. Now, the interesting thing that happened was that when we started eating healthy, we discovered that we had more energy than we had had in years. I mean, I felt like it did when I was in my 20s. And this was unbelievable. And I had to do something with that amount of energy. And so about 3-4 weeks into my lifestyle change, I went out and bought a mountain bike and I started mountain biking. And I started hiking and started walking and started swimming and doing things that I had never done before, or at least hadn't done for a number of years. And after consulting with my doctor, and after roughly 6 to 8 weeks in the process of my lifestyle change, I didn't need the blood pressure meds anymore, and I haven't taken them since. My total cholesterol dropped all the way down to 131. My HDL, which is the good cholesterol that you want to be high, you know, I've never gotten it out of the low 30s, never in my memory. But because of all of my activity and my new renewed energy, my HDL is now in the upper 40s. I sat in the office with my cardiologist. He asked me a question. He says, so what has been the reaction of your friends and your colleagues and other people that you've encountered? And I said, you know, it's interesting because I said some of my friends and colleagues have kind of given me a little bit of pushback with this. They say, you know, Phil, don't you think you're being a bit radical? He says, next time anybody says what you've done is radical, tell them this. When we as physicians have to crack someone's chest open and do quadruple bypass surgery, that's radical. When we have to put a stent in someone, that's radical. He said, even when we have to prescribe statin drugs, he says, that's radical. He says, what you've done isn't radical. It makes sense. And he said, congratulations. And he said, just continue the journey. I hadn't seen my daughter in quite some time. And she actually saw me several months into my journey. By that time, I had lost a significant amount of weight. And when she came up to me, she threw her arms around me and she gave me this great big hug and she said, Papa, she says, you know, she says, this is the first time in my life that I've been able to get my arms all the way around you. I want to be there for my wife. I want to be there for my children. I want to be there for my grandchildren. And I realize that the choices I've made and the changes I've made are sustainable. They're not some gimmick, not some mail order shake or something that, you know, you're on a diet for a while and, you know, and then you go back. What I'm doing is sustainable. And it has been deeply inspirational to me and to others. And I'm just so excited to be able to share that journey with other people and encourage other people on that journey.
That's awesome.
I have to say, Doc,
Yeah,
sorry, I get
You
emotional.
got tears in your eyes. That's awesome, man. That's worth having a good cry over.
when I sat in my doctor's office and he gave me my labs, this was just earlier this year for my complete physical checkup, and my total cholesterol had actually gone up a little bit, and I was really worried about that. And then he says, here's the reason why.
HDL.
Because my HDL had shot up to, I think it was like 46 or 47. And when he showed me that, he had to hand me a box of Kleenex. I literally broke down.
Yeah. So that's, you know, a 15-point increase in the HDL is a huge increase.
So let's take a look at these labs. Now, I want to tell you, and I'd like you to comment on these. It's kind of a little bit small, but let me talk about these labs. I want to tell you that these were, I'm not including my present labs. These are not my present labs. These were the labs of when I started Diabetes Undone. I had my labs drawn on the 8th of July of 2018, and then roughly 6 weeks later. So I didn't put my present labs because I want you to talk and for you to share just how dramatic the changes are over that 6-week period of time of following a whole food plant-based diet.
Okay, so let's begin by looking at the fasting blood sugar right here at the top and the hemoglobin A1C. So the easiest test to draw, and one of the tests is going to be included next Sunday as a pre-test for the Diabetes Undone program, is looking at the the average, this is like an average estimated blood sugar over the last 4 months. The red blood cells in our blood typically on average live 120 days. And so every day, every time you eat and the blood sugars go up after the meal, that spike in your blood sugar will create a caramelization, a glycosylation, where that sugar literally irreversibly glazes itself to the hemoglobin protein that carries iron and oxygen inside your red blood cells. And so this is a percentage of the hemoglobin that is irreversibly caramelized by glucose, by sugar. And so Pastor Phil started at 6. Now 6 is basically right there getting into the more advanced moderate level of prediabetes. Okay, where you know, that right there dramatically increases risk for a heart attack or a stroke. It dramatically increases risk of cognitive decline. It means that you were insulin resistant at that point. Your body is trying to control for that higher blood sugar. Your fasting blood sugar, after all, was at 108, and that's right close to that threshold of what we would call advanced prediabetes. Once you hit like close to 110 on a fasting blood glucose level, a blood sugar level checked before breakfast, that's advanced prediabetes. 100 is the beginning officially of pre-diabetes. But that was, so he basically lowered from almost advanced pre-diabetic to just into the pre-diabetic cutoff right there. Now, but when we look at the hemoglobin A1C, which looks at an average over the last 120 days, Pastor Phil, you actually went from a moderate pre-diabetic score to just under the pre-diabetic cutoff. And so most of the time, the kind of official way to determine if you have reversed pre-diabetes is you're looking at the hemoglobin A1C, and has the average blood sugar dropped under 5.7, which is the beginning criteria, meeting the minimum criteria for pre-diabetes.
And this was just in 6 weeks.
That's in the first 6 weeks. Now later on this evening, I'm going to show you some case studies of a 90-year-old gentleman I worked with, okay, and what he was able to do. He started out with out-of-control diabetes. So Pastor Phil, as important as what you just did in that 6-week period, you are not Superman. Mm-hmm. Okay? This isn't something that Pastor Phil was able to do because he's got such greater willpower than you or I. This is something that everybody can do. Mm-hmm. Everyone can do this if they take that, what you call, Pastor Phil, trip to your mind. Mm-hmm. If you fully engage and help yourself recognize that this is the most joyful, pleasant, positive thing that you can do for yourself, right? Rather than thinking, oh man, you know, I got to just suck it up here and, okay, I'll do this program. You know, if that's your mindset, you're probably not going to be that successful. But if you recognize that this is actually going to liberate you, right? That's what it does. I mean, you know, just the fact that you don't have this pain anymore. It's a liberation from pain. How many of us who've actually experienced chronic pain would be saying, hey, I had a patient 30 years ago when I was practicing in Sun City. He says, stop apologizing to me, doc, for how hard this is going to be. He says, if you tell me I got to eat barbed wire to be healthy, then I'm going to eat barbed wire, you know. So it's like, so it's like some of us are recognized that the investment, the energy, the effort that we put into a program like this is what liberates us. Okay, so A1C, you know, dropped under the pre-diabetic level. Now let's look at cholesterol. Now, were you on any medicines at the beginning? Okay.
No.
So you know, the cholesterol initially 169, which isn't a horrible cholesterol level, but what was so telling here is that after, see, one of the reasons the body produces cholesterol is try to fix something. The body uses cholesterol. Cholesterol is actually a toxin sponge. It's also helps fix areas where inflammation, damage has occurred into arteries. That's why if it's out of control, it can produce plaque. But it's initially designed there to help heal areas. So cholesterol in of itself isn't bad. It's just when your body has to produce a lot of it to address the problem, that's the bad part. And so what happened here is Pastor Phil's cholesterol dropped from 169 to 131. It basically means that the body's going like, whew, I can now stop producing this extra cholesterol for me as a person, for you as a person, and you now reach your set point that's proper for you. So that's a sign that your level of inflammation that normally stimulated the liver to produce all that extra cholesterol was no longer triggering that production. Okay, so that's a major improvement there. The LDL cholesterol, typically, you want it at least under 130, but now the goal is to try to get it under 100, and you went from 107 to 81. So that's a great drop in that LDL, quote, bad cholesterol. Then the HDL cholesterol. You notice here that the initial change of the HDL cholesterol was a drop. And then later on, you actually had an increase. You went up over 10 points from this point
I went up
to 45.
I went up to about 140. I think I went up to 46 or 47.
Okay.
The last time I was tested.
But it's not uncommon for when you get on a healthy nutritional program, healthy lifestyle, for your HDL, your quote healthy or good cholesterol, to drop even significantly. So I don't see that as a bad thing at all. I see that as the body just resetting, saying we don't need a lot of tow trucks and garbage trucks anymore because now you have cleaned up the diet, so we can kind of relax a little bit. Okay, and then continue the cleanup process later. So that's by the way not a huge drop, anyways. It was definitely lower than I'd like to see initially, based on an unhealthy diet. But see, I always tell patients, why do you want a lot of garbage trucks and tow trucks around? If you have a lot of accidents, you want to have a lot of tow trucks around. If you have a lot of damage going on, you want a lot of HDL around. It's there to help remove the damage from the artery walls. It's called the reverse cholesterol transport system. And so ultimately, and probably one of the reasons your HDL went up is because of your consistent effort to exercise. We know from many studies that the more consistent somebody is in their fitness regimen, that tends to stimulate a higher production of HDL.
And the last time I had my labs done, my total cholesterol was higher, but the reason why it was higher was because my HDL was higher too.
Yeah.
My triglycerides there.
Okay, so you started out. We normally say with the blood fat. See, cholesterol is really not a fat, but triglycerides are actual fat, and so these are the fats that are floating around in the bloodstream. And so, yeah, the acceptable range is under 150. They're metabolically speaking. Once your triglycerides go above 150, then we're more concerned about that. And so you went from a very reasonable, acceptable level to a much more acceptable level. Basically, under 100 would be more ideal.
Right, and
Okay,
last time I had it checked, I think I was in the 50s.
Yeah, so that's awesome. That's very good. Okay.
The next slide, just go show one more slide, and then we'll. I want to talk about what happened to my blood pressure. In June of 2012, uncontrolled, my blood pressure was 155/95. So then, you know, my doctor, he wanted to put me on some meds, advance it again. So July of 2012 through July of 2018, my typical blood pressure controlled, that second way, it was 135, not over 95, but over 85. That was a incorrect deal. 135 over 85, controlled with meds. I was on 2 different medications. Now, my typical blood pressure, this one, when I did this particular day, I put this slide together, my blood pressure was 114 over 69. But typically, it's in the 120 or below range, over the 60 to 70 range.
Yeah, and so that's a perfect blood pressure.
With no
See, so our goal, our primary goal here isn't to get rid of medicines. Our primary goal here is get so healthy you don't need them anymore, right? And so if you need them, well, you need them, okay? But if you don't need them, then your doctor should be happy to help you come off those medications. But you have to, that's, again, one of the reasons that we're doing this Diabetes Undone program is to provide the fundamental strategies that are most effective in improving all of this. It's not just for a diabetic. We call it Diabetes Undone because that's the tip of the iceberg. You know, if you can reverse the most obvious problem metabolically in the average person in America, diabetes, you can reverse everything that's going on underneath it as well. The underlying metabolic drivers of diabetes are the same metabolic drivers of hypertension, of weight gain, of cholesterol problems, of heart disease, of strokes, autoimmune disease, you name it, cancer, Alzheimer's. You know, I probably spend more time than anything else right now in my clinic helping people with Alzheimer's. Probably, I would say 70% of my practice now is helping people. And what I'm finding, I'm more aware of now than I ever was, because my main specialty for many years was helping people reverse diabetes. But I got interested in Alzheimer's because of what we said last night. You know, that Alzheimer's is essentially diabetes of the brain. Okay, and so I was able to take all my knowledge of helping people reverse diabetes, type 2 diabetes, and apply it to helping address cognitive decline and helping people even reverse aspects of cognitive decline. So the Diabetes Undone program is the core for reversing insulin resistance, which is one of the main underlying factors across the board. Now, you know, you could have been easily, because of your health issues, like many people, as soon as there's any concerns about prediabetes, diabetes, hypertension, they start thinking about controlling your lipids further with cholesterol medications. Your LDL was actually higher than optimal, so you could have easily gotten put on a statin medication. But here's the irony of that. Statin medications may have their place in certain cases, but for the most part, we know that statins increase, these are the main cholesterol-lowering medications, they increase insulin resistance, which I argue, and based on good evidence, that it's one of the main, or actually can be considered to be the main cause of heart disease. So why do we put patients on statins? To lower cholesterol, but why? What's the point? The only reason is to protect people from heart disease. But if I'm using a statin that lowers cholesterol, that actually increases a more important risk factor, okay? So that's why it's so critical that we address the underlying causes aggressively, and then we get to the point where we no longer meet the criteria for required medicines that actually, in some cases, can do us more harm than good.
So I wanted to just share this stuff because maybe to debunk some myths that, you know, that what difference can this make in my life? And I presented this to show that in just 6 weeks, there was dramatic change in my life. And as I said, my labs now are significantly improved even above that. I don't have the pain that I used to have, and I'm feeling great. But Doc, one other thing, and then we'll get to some other of your questions. But one of the big challenges, and I go to this, and the first step I said was the trip to the mind, and that's engaging the mind for change. And for me, I had to come to the realization that the desire to change became greater than the desire to remain the same. That was the key point for me. I decided I was tired of living the way I was, and I heard of other people's success, and I said, if they could do it, I could do it. I remember when I was just a kid, I was probably about 10 or 11 years old, and my mom worked in a physician's office, and after school I walked to the office there, and then she would take us home, and I remember walking in one day, and there was a poster on the wall of this doctor's office that stuck in my mind, and I never, ever forgot it to this day, and this is what it said. The person who says it can't be done is usually interrupted by the one who's doing it.
I love it.
And I decided that I was going to put that to practice with my own personal health. You know, I had for a year said this is not possible for me to do, and I think I've proved it is. And again, I want to say that this wasn't a journey I took by myself. I credit my dear wife for holding my hand in this journey and joining me. And that's why I want to say, if you are thinking about making those changes, don't try to do it by yourself. Have some support. Have people there. That's why we have this opportunity through Diabetes Undone. That's why we do See Me Fit and these other things, so that we can hold your hand. Have your partner, your spouse or friend or whatever join you in this journey to encourage you. But I think there's one other thing that's bigger than that, and that's the other. There's so many other things in the mind. You talked last night about your friend that you'd worked with for a number of years that was a multimillionaire and sadly, you know, made the changes and then sadly digressed back and then died recently at the age of 61, which ironically is my age.
Yeah.
Okay. I think one of the
Yeah,
big
he
things.
died Monday.
Yeah.
This week.
One of the big tragedies is these games that we play with ourselves. That thinking it. You know, if you watch any TV at all, folks, watch the news or something. What are one of the big? Jan and I will watch the evening news, and one of the big advertisers are the drug companies, and they'll talk about, you know, if you have type 2 diabetes, take this pill, and it shows all the magic it can do for you. And I turn to Jan, I say, what a bunch of bunk. I mean, it is just craziness, absolutely insane. But we have gotten ourselves to think that we can do the quick fix. I've had so many people come to me and say, hey, listen, wow, you're amazing. What's happened? Did you get sick? And I say, yeah, I got sick. I got sick and tired of being fat. That's what happened. But, oh man, I want to make changes. But here's what I've discovered, is people want to change, but they want the quick fix. Give me a pill, whatever. I don't want to go through the pain of what I need to. But I will tell you, the pain that I went through was well worth what I've experienced now. And to be honest with you, Doc, I didn't go through that much pain. Once the train started leaving the station and I started experiencing success, that was the motivator for me to continue on in my journey. Mm-hmm. But sadly, there are so many people that think recently Jan encountered a friend of hers whose husband is a medical professional. And she commented to Jan, yeah, my husband's been through Diabetes Undone two different times. And he's a diabetic, but, he just finds it so much easier to pop the pill. I'm thinking, sad. This is a medical professional that has that kind of an attitude. I've encountered some people that say, well, I've got really good health care insurance, so I don't need to worry about it. I'm telling you, it's amazing the sickness in our minds, and I know I understand that because I used to be morbidly obese, and I understand how sick I really was in my mind that convinced me that where I was where I had to be. So I can't say enough good to you and others who have assisted in this program to make it possible for people like me to make this significant of lifestyle change. And I say thank you to you, and I say thank you to God.
And thank you to Dr. Westerdahl that can be involved with this. Thank you.
So we have some other questions here. Yes.
I have two questions, Doctor. Can you tell us the combination of foods that can affect you? I like to eat an apple a day. They said, no, don't eat an apple because apple has sugar. Don't eat figs because figs is sugar. Don't eat watermelon. Don't eat beets. So what do you eat? Can you explain to us the combination of foods that somebody can eat that won't develop sugar? The other thing that interests me is you see the Asian people with a big bowl of rice, couple pieces of broccoli, with their chopstick, eating happily, and they
Eat it happily.
are they all diabetic?
Well, it's, Dr. McDougall talked a lot about that. See, there's many different levels of what may be appropriate or optimal for a given person. And so that's why clinically, I think the important thing is understand that we need to come up with a plan that's best for us as an individual, right? And so that's why we look at, for instance, some people, when I do a glucose tolerance test on them, their blood sugars are high, but their insulin production is super high to compensate for that. So their pancreas is able to produce a lot of insulin, just not as much insulin as necessary to fully control the blood sugar. In other words, if we reverse the underlying insulin resistance, they get better very quickly. They reverse this very quickly. Okay, but there's other people who have had high blood sugars for so long that, without even knowing it potentially, they've been producing all this extra insulin for 30, 40 years. Their pancreas goes like, I'm done. I can't do this anymore. So we call that pancreatic failure. And so their ability to produce insulin now has dropped so low to maybe 5% or 10% or 20% of what it used to be able to produce, that it's no longer just reversing insulin resistance that needs to be done. Now we need to control total intake of especially the more refined carbohydrates. And so that's why, as a rule, anybody that's trying to improve their health in any way, okay, I say just get rid of all refined carbohydrates, get rid of all sugars, but that does not include an apple. An apple a day is a good thing. In fact, there's been studies published in top medical journals saying that eating an apple a day is at least as powerful as taking a statin medication and lowering your risk of a heart attack. Okay, and so remember, we got to come back to the bottom line. The only reason we treat diabetic patients is to prevent the complications. Having high blood sugar in of itself is not a disease. It's a sign that something else is going on that increases the risk for heart disease, stroke, cancer, Alzheimer's, etc. And so we need to make sure that we're following a program that's good for that. And that begins with promoting a whole plant-based diet. That's why we don't say, I don't say vegan, because that's not descriptive enough. Okay, you can, I've eaten a vegan diet in the past. It was really bad. You know, I was like, oh, I'm vegan, but as Pastor Phil was saying, you can be munching on potato chips and eating French fries and eating Fruit Loops. You know, and that's vegan, right? So we need to focus on whole food that has all the nutrition in it. I have no problem with an appropriate amount of watermelon. I had a watermelon the other night. But here's my point. Know how it affects you. In other words, one of the things that we're going to be recommending to anybody joining the program, a handout will be given out that shows you how to check your blood sugar, especially if you've had at least prediabetes in the past or diagnosed with it during this program. And Dr. Lorraine will help you understand, Dr. Barton will help you understand what that means. She'll actually be presenting, is that correct, at one point? Mm-hmm. Maybe? Okay, so to help you understand what these numbers mean. But the point is that some of us need to be more careful about what we eat and how we eat it. And so we'll be checking your blood sugars before and 1 or 2 hours after every meal temporarily to see the impact. Okay, and so if your blood sugars are going high after a meal, we want to be more cognizant of how we combine that whole plant-based diet. Because there's different ways to do whole plant-based. Okay, and there's some ways for diabetics that work better than other ways. And so that's why it takes time, and the program will address that.
Any other questions? Wow, okay, here. Yeah, here's some right here.
I was one of those people who, I took Diabetes Undone just for the fun of it. And
Okay.
I was pre-diabetic and didn't realize it, so thank you.
Oh.
I've heard you talk before
So
about...
you're one of the 90% of the public who think everything's great, but because of your health interest, you took the time and made the effort to get tested. You go like, whoa, you know. So here's a point. There's a lot of people that are lean, that are thin. So a lot of people think the only reason to be diabetic or pre-diabetic if I was overweight. That's not true at all. Okay, I see just as much people who are normal weight or even underweight who have problems as people who are overweight. Okay, and so we need that's why we need to test. Everybody needs to test. There's no way around it. Otherwise, we just don't know.
Thank you. So my question is, I've heard you talk before about 23andMe, and I know there's opportunities to take your data and have that analyzed through other places and other programs, and I think you've talked about that before. Can you say what your recommendations are?
Yeah, so I've for many years now recommended and done it myself. My whole family's done it. It's a saliva sample that you provide through 23andme.com. You just order it online. It's a one-time expense. You never have to pay anything more. It's roughly about $200. Sometimes you get discounts. Thanksgiving's coming up. I guarantee they'll have a discount for that. Christmas is coming up. They'll have a discount for that. They have discounts throughout the year. But it's one of the best investments in your health if you pay attention to the data. So what I actually recommend is once you have the analysis, once it's completed, you download the raw data file. It's an Excel file. And then you can upload that into other apps or other websites that have very robust search engines that can tell you what that data means. And there's all kinds of startup companies now that are doing that. Now, one of the concerns that some of my patients have raised, which naturally most of us would have, is like, well, wait a minute, you know, what if somebody gets a hold of my genetic data? Guess what? They already have it. You know, so somebody wants your genetic data. It's not that hard. A strand of hair, you know, a little bit of saliva, you know, a stool, a little piece of stool, a little bit of blood. So if you've ever donated blood, they already have it. Okay, so at least you should know what it is, right? Don't just let everybody else know what your genetics is. Okay, at least you should understand so you can make the personal choices that help bypass those genetic mutations that you've discovered. Because if there's one thing I know, when I studied biochemistry at Loma Linda University, I wondered once in a while, am I ever going to use this information? Okay, I am using it now because genetics tells us precisely where on the biochemical pathways there is a problem, which means that I can zero in on your physiology and tell you exactly where there's a problem and what enzymes are at risk and what cofactors influence that enzyme. And nutritionally speaking, we can modify and basically neutralize the negative influence of that mutation. We truly can be masters of our genome now because we understand the biochemical pathways. Genetics has always been thought of as a mystery. What can you do with genetics? Well, genetics runs everything, but it determines the formation of the enzymes that make life possible. And those enzymes always work just on what? Nutrients or toxins interfering with it. So that's why the two main things that's our job as being good stewards of our health is optimizing nutritional elements, because those are the main sources of optimizing those pathways, including those related to mutated genes. Okay? And then number two, it's the toxins that tend to interfere with what the nutrients are trying to do. So between the two of them, what's the most important one? Optimizing nutrients. Because when you optimize nutrients, you're negating the potential damage of the toxin in question. Not necessarily completely, but in a major way. So if you do both of those things, if you're paying attention to removing yourself from exposure to toxins as much as possible, which, by the way, is primarily done by eating a whole 100% plant-based diet. That's one of the most important ways to remove us from toxins, and then, of course, paying attention to environmental sources of toxins, which, again, most of that ends up on the food, so that's why we got to pay attention to the food as well. So by doing those two things, genetics becomes a powerful tool to help us move forward and make decisions. Now, the challenge with the data is having somebody that understands the language of genetics, and that's a very rapidly expanding field right now. I have various family physician friends of mine that work in my area, and they will just say, listen, I'm glad you're doing it. I'm glad you're addressing genetics, but most of us doctors have no business getting involved in genetics because there's just too much information there. So unless you do it right, don't get involved in it. So and these are really smart guys that really know their medicine, but they recognize that unless they want to develop a niche into it and really do it right, they stay away from it. So working with somebody that spends a significant part of their practice doing genetics and explaining to people how that works and what that means for them, that you want to find somebody to help you with that. Okay, so let's see, who's got the mic? Right here. Okay, yes.
Doctor, excuse me, this is not a question. This is just to augment Hosanna's statement regarding the Asian people eating rice.
Yeah.
Now, I have that book, The China Study. And the reason why I'm here and saying this is because I'm Asian.
Yes.
In Philippines, they eat rice 3 times a day.
Yes.
The
I know, I've been
entire
there.
Asian country will be dead without rice.
Yes.
The entire Middle East, the whole Arabian country out there
Yes.
will be dead without rice. Half of the Latin America, they eat rice. And I placed a question in the internet. If all of these people are eating rice, are we all going to be dying of diabetes? No one has answered back to me. But I think that culturally, I eat rice a lot. But culturally, I think is that our body adjusted to our way of living. Because from the moment we're born, we're only like 3 months old. There's no milk in the poor countries. There's no Pablum or baby oatmeal. They boil the rice and feed you.
Right,
and so
right.
we had to eat it, whether we like it or not, to survive. I
Right.
survive on rice. And
Right.
so, doctor, I don't know where I stand on that, because the Asian people will be dead without the rice.
Yeah, and that's why you didn't hear me say rice was bad for you. Okay, I didn't say the rice was bad for us. I think we need to individualize. We need to find out how rice affects us. So that's why in the program, Diabetes Undone, we're checking blood sugars before and after different meals. If your blood sugars are optimal after consuming rice, then and also your insulin levels are optimal, then that your body, you're doing great with that. So back in the day, okay, all throughout Asia, when the average person worked most of the hours a day, they were very busy physically, if they didn't have rice, a lot of it, 3 times a day, they would die of malnutrition. Okay? Now, in most places of the modern world, that's not true anymore.
No.
That's not true anymore. Like in my work, if I didn't actually go out and exercise and work out and play basketball and sports, I'd get no exercise at all in my work, because I just sit there and talk to people. You know, the most exercise I get at work is standing up to grab the next patient, right? And so in a large part of the developed world, certainly here in North America, we're so out of shape that metabolically we can't handle a high level of even the healthy carbohydrates anymore. And there's a lot of misunderstanding about this. And so that's why I say check yourself. Don't take my word for it. Don't take any other doctor's word for it. Everybody's got their own opinions. But in the end, our opinions don't matter. What matters is how does it affect you? How does it affect each of us? And so that's why this is a clinical question that is determined individually. And so now, for instance, some people who have high blood sugars, who have metabolic risk factors, they need to be more careful initially and shift the proportion of their plant-based foods more to the non-starchy vegetables and more to the legumes, which are starchy, but they're high fiber, high protein, and less to some of the other grains. But as they get healthier and healthier and healthier, and as they exercise more and more, they can actually shift it back. Okay? As long as you stay metabolically healthy. And how do we do that? We check the labs like Pastor Phil did. We check the triglycerides, check the fasting and the after meal blood sugars, check the A1C. If those are optimal, then we're pretty confident that you're okay eating a diet that culturally worked back years ago when the population was fit, was lean, was working hard physically. But that's shifted, and it depends where we live, right? And what we can handle food-wise. So that's my unique perspective on that, and I totally agree with you. We just need to make sure that we check for ourselves if it is really healthy for us. And then there's the question of not just rice, but Brenda Davis, who's my favorite nutritionist in the world, she just came out with a new book called Kicking Diabetes. You know, getting rid of diabetes, and she's probably the most respected dietitian in the world on the question of diabetes. By the way, she's the one that does Diabetes Undone with me on the videos, Brenda Davis, and she basically points out that there are thresholds or different levels of whole foods, okay, or whole grain, for instance. There are 10 different levels of whole grains, and especially for somebody with prediabetes or diabetes, we should only be consuming the top 2 to 3 levels of those whole grains, because most whole grains are actually not healthy for us, especially if we have a metabolic problem. In other words, if you look at the box and say, oh, this is whole grain, that doesn't mean it's good for us. And I will show you that hierarchy this evening when we do our final presentation. Okay, a question in the very back. You've
Just
been very
wanted to
patient.
ask you about the controversy over avocados. Can you eat them every day? Are they the worst things to eat? How does it impact the body?
Okay, so, well, I know that's a loaded question, right? Because there's probably various different opinions out there, but I tell you my perspective on this. Okay, a healthy avocado, I mean, you know, this territory around here, you know, healthy avocados, those are really good avocados. And I am a great believer in using healthy fats appropriately, whole food, plant-based fats appropriately, especially in metabolic syndromes. And my perspective may be somewhat different than some of my good friends and colleagues, but and Brenda Davis, by the way, who I feel is pretty much almost the final authority on what is appropriate or not in this plant-based field. She's the one that's always, if I ever said anything that she disagreed with, she'd be on me immediately. Okay, she'll challenge anybody, Dr. Esselstyn, Dr. McDougall, Dr. Neil Barnard. You know, sometimes we get so into our philosophy of health that we'll say things that actually aren't true, okay, or accurate, I should say. And she's on it. So she's a true scientist, and she'll say this: it's not actually the percent of fat in your diet that makes it healthy or unhealthy. Contrary to popular opinion, it's whether or not that fat comes from whole foods or not. Okay, that's the main issue. If you look at the healthiest populations around the world, they go all the way from 7% fat in certain cultures all the way up to 60% fat in certain cultures. Okay? But if you're getting fat from whole foods, the population seems to be healthy. Okay, so now the real issue here is when you start refining fats into oils, that's when you get into real problems. Okay, so I would say, to answer your question simply, I would say one of my favorite breakfast foods is we will stir fry in a little bit of water, chopped onions. I mentioned this last night. Chopped onions, chopped mushrooms, chopped purple cabbage. You know, colors, the pigments that change, transform genes in the proper direction. Okay, and then we'll add maybe some other things, and then a whole bunch of baby spinach. Simmer that down. Have a big old bowl of that for breakfast. In addition to other healthy breakfast foods, but that's the core. And I'll put like several slices of avocado on that. To me, that's a perfect start of the day. And I wouldn't have any problem doing that every day. In fact, to me, that's one of the healthiest ways that you can begin a day, with all the nutrients coming from those healthy foods, including some healthy fat, which Dr. Joel Furman he would argue this very strongly. Says you cannot be healthy. You're not meeting your health goals optimally unless you're eating a moderate amount of fat daily with every meal. Okay, so in other words, a low-fat diet, a truly low-fat diet, impairs your ability to absorb nutrients, especially fat-soluble nutrients. So that's not a license to gorge ourselves on avocados, etc. It's basically a statement saying we should incorporate healthy whole food fats in our diet on a regular basis, including nuts and seeds. And so I would encourage us, especially those of us that are trying to improve our health, to include healthy whole food fats of those kinds, olives, etc., in our diet on a daily basis rather than avoid them. Okay? And I would say that is a priority over emphasizing the starchy grains, especially the ones that are not optimal or at the highest level of whole grain. The best, and I'll show that slide later on. Here.
Hi, I just want to concur with you on several things. Probably some of you have heard the studies about Japanese who moved from Japan to Hawaii and then to the United States. And each time they moved, they got less healthy, right? Because of just their change in their diet, etc. But also, some of you may not know that in California, at least, I don't know about other states, that Filipinos actually have the highest rate of hypertension. And it's not always because you're overweight or anything like that. It's because of the high salt content as well. So we aren't just interested only in fat. We have to think about salt.
Right. Good points. Thank you, Dr. Barton. Okay, yes, in the back here.
I was wondering the difference between soy and is soy good for you protein or pea protein?
All right, great question. The point on soy is that when you're using soy protein, you really want it to be organic. Just because you want to minimize your exposure to toxins. Speaking of the genetic test, one of my favorite SNPs, these single nucleotide polymorphisms that we look at in genetic testing, is what I call the PONY gene. PON1 is the official name of the SNP, and that is a gene that codes for an enzyme that is the primary enzyme in the body that breaks down pesticides. And if you have a double copy mutation, otherwise known as a homozygous mutation of the PON1 gene, or what I call the PONY gene. I call it PONY because I envision a pony running through a toxic waste dump. Okay? And as this pony's running through this toxic waste, you'll never forget this now, it's bumping into these rusty barrels of pesticides that are just splashing pesticides all over the pony. Okay? And so that PON1 gene mutation, double copy in particular, dramatically decreases our ability to get rid of toxins that are most commonly found where? In our food supply. And so that's why paying attention to the environmentalworkinggroup.org or EWG.org, where they have the Dirty Dozen. You can just Google Dirty Dozen, and that'll tell you the 12 fruits and vegetables that have the highest load of pesticides on them unless they have been grown organically. And so that's why those Dirty Dozen, you want to eat organic, especially if you have the pony gene mutation, because that means you get exposed to pesticides, you can't get rid of them. I'll try to remember to show this again this evening. The pesticides or basically pollutants from our food and our environment are actually much more. We're talking about 1,000% or more responsible for diabetes than being overweight. In other words, in fact, what we're now starting to understand that one of the actual causes of excessive weight gain is actually unhealthy ability to get rid of toxins. And so what the body does is one understanding of this is that the body will actually hold on to fat and take on more fat so it can control more toxins, because that's how the body in part controls toxins, is by just absorbing it into the fat cells. And if the toxin is in the fat, it's not metabolically active. So that's why, especially when you're on a weight loss program, you really want to desperately be on a 100% plant-based diet, because that's where all the nutrients are that are protecting your liver and protecting you as you release all those toxins back into your body's environment by getting rid of that fat. Okay, so that's why you want to have the right foods in your system. And that means lots of the non-starchy, colorful vegetables and regular fruits as well. It's the colors that give us the healing component.
I have just heard that vegans or people that do a plant-based diet have a higher risk of hemorrhagic stroke. Have you heard that?
Dr. Barton, do you have anything on this? I'm searching my memory for there's certain studies that I think relate more to actually what Dr. Barton was saying about being on a diet that might be high in various plant products, but also sodium. Okay, also sodium. So hemorrhagic stroke, again, where you're bleeding, right? So you're bleeding, you have a brain bleed. Obviously, you don't want that. Now, hemorrhagic stroke is much less deadly in terms of numbers compared to the clotting type strokes, right? That where the thrombotic strokes, where you're actually a plaque in your artery here bursts, and now you have a clot forming that blocks blood flow to the brain. Same thing can happen in the heart, causing a heart attack. So the bottom line is that overall, sometimes studies come up with weird findings, and they become extrapolated and interpreted in ways that really are not appropriate. So I would say this: I would never caution somebody to avoid a plant-based diet if they're at risk of hemorrhagic stroke. To me, that would be a misapplication of the science. I would actually encourage them to any type of metabolic or cardiovascular disorder. They're usually going to be better off, always going to be better off, eating a plant-based diet, but then looking at the clinical specifics carefully to make sure that we're covering all our bases.
Okay, we have time for one last question right here.
Okay, so does eating a plant-based diet help with regards to type 1 and type 2 diabetes?
Great question. So, yes, I frequently have patients that will come and say, well, what about type 1 diabetes? Here's the bottom line. I've been treating diabetics for almost 30 years now. And so I've kind of seen it all, And now type 1 diabetes represents roughly 3% of the total diabetic population. So most people with diabetes have type 2 diabetes at different levels of insulin resistance. Some of them are more type 1.5 diabetics because they have lost the ability to produce insulin. But a type 1 diabetic within weeks of diagnosis, have lost essentially 99.9% of their ability to make insulin. So they require insulin. So it's different from that perspective. The bottom line here is that type 1 diabetes is a very different condition because of the cause. It's a totally different cause of high blood sugars. And that is why we have to be very careful in extrapolating the data from type 1 diabetes studies to type 2 diabetes. And that is precisely why this is based on the Mayo Clinic studies that just came out a year and a half ago. That is precisely why 95% of all the guidelines that we as clinicians think are solid, based on all evidence-based information, that if you lower your blood sugars in type 2 diabetes with a medicine, that it will dramatically lower your complications. Guess what? It's not true. It's only true if you're type 1 diabetic. If you use a medication, which you really don't have a choice, if you use insulin as a type 1 diabetic, you're simply putting back into the body what you can't produce yourself that should be there. That's like using a bioidentical hormone. You're just putting it back into the body at a level that is appropriate for somebody who's otherwise metabolically healthy. And that should be, for a type 1 diabetic, an amount of insulin that generally is between 20 and 30 units a day. So, if you have a type 1 diabetic diabetic who's requiring much more than that, then it's more than not being able to produce the insulin now. It's more than just type 1 diabetes. There's actually, see, what we forget is a type 1 diabetic is just as prone, if not more prone, to develop type 2 diabetes as anybody else. But nobody ever thinks about that, right? There's nothing that says if you're type 1 diabetic, you can't also be a type 2 diabetic, which speaks to cause. See, that's the easiest way to understand this. So type 1 diabetes is caused by a aggressive autoimmune condition or toxins or trauma to the pancreas so that the beta cells of the pancreas no longer can produce insulin at all. Okay? Okay? That's totally different than the type 2 diabetic who developed that because of insulin resistance that gradually got worse over 30 to 40 years in most cases. Okay? And then little by little, the pancreas loses its ability to produce insulin, but that can be regained, unlike the type 1 diabetic, typically, as far as we know now. Okay, so a type 1 diabetic can gain just as much, actually more benefit from doing a Diabetes Undone program, not because they're expecting to be able to completely negate the use of insulin. That's not the point. Okay, but what they should expect is to be able to improve insulin sensitivity, which I almost guarantee almost every type 1 diabetic is just as likely to be insulin resistant as the rest of us, right? Which is most of us, okay? And so that's why we're all benefit from this type of approach. And once they do that, they no longer need the excess insulin that they shouldn't have to take, okay? Because I would argue that for many type 1 diabetics, the majority of the insulin they take isn't because they're type 1. It's because they're type 1 and they have the additional burden of type 2. Okay, so that's a totally different perspective that I don't know if I've ever heard anybody else talk about it. but you just think about it, it just makes sense, right? And so that's why the person who benefits the most from 100% plant-based diet and a comprehensive lifestyle medicine program like Diabetes Undone is going to be the type 1 diabetic, because they're the ones where blood sugars matter the most, right? Because they're the ones that have the big spikes and valleys and ups and downs of blood sugar, which damage the brain, damage the pancreas, damage the kidneys, damage the nerves, damage the heart, damage everything. Okay, and so once we get past the notion that just controlling blood sugars is everything, it's not. It's the beginning. But the bigger issue is getting the nutrients that the body uses to protect and restore and regenerate tissue appropriately. So that's a great question.